On a busy Memorial Day weekend, there were large crowds across the Commonwealth, even here in Metro Richmond, where the region reached the CDC's high-risk level for COVID spread. Now, infectious disease experts are urging people to take safety precautions.
I think this is a potent reminder to all of us that COVID-19 has not gone away. It's also a reminder to many of us that if you're not vaccinated, now is the time to get vaccinated. If you're vaccinated and not boosted and eligible for a booster, it's time to go for a booster.
Physicians are also asking people to wear a mask if they're indoors with large crowds or poor ventilation. With many schools still in session, pediatrician Dr. Eric Freeman says he's seen a spike of cases among young people.
And I think the symptoms have varied tremendously. I have had very young children come in with very mild upper respiratory cold symptoms. I have had many of my older pediatric and adolescent patients who really have thought it was just their allergies, but it was probably allergies plus potential COVID. I've seen a lot of people come in with headaches, which is a very common manifestation that we see with COVID, and think they have sinus infections, and actually they have COVID.
Freeman continues to encourage vaccinations and boosters for all eligible children above the age of 5. While Virginia schools have dropped mask mandates, Freeman says parents should consider masks for children who fall into high-risk categories. He's also encouraging testing for COVID if there's any symptoms and staying home when sick.
I think you really have to evaluate whether it is your child or yourself. What is your level of risk personally, and then what level of risk you're willing to tolerate? I think you have to look at a variety of factors. I think your age, particularly if you're in the elderly population above the age of 50, or if you are a very young child, those are very strong categories of risk for COVID infection. If you have any type of chronic health issue, or if you have evidence of you're a transplant recipient, you're immunosuppressed, you may have an immune deficiency, I think you have to think that you're at high risk for potential COVID transmission.
While new cases and the percentage of positive tests in Central Virginia are currently outpacing statewide averages, doctors say they'll continue to closely track COVID-19 hospitalizations. As COVID cases continue to rise in our community, doctors say there's a risk of increased hospitalizations. While hospitals are not being overrun at this time, they say there is that risk if proper mitigation strategies are not followed.